screen.
Oh, okay.
Everybody got that?
You need to get on and load up to your staff.
We're gonna do community-wide scheduling today, and for the nursing department, what that involves is scheduling for your ED scheduled patients and your scheduled floor patients. So ED scheduled patients are things like your IV injections, dressing change, IV antibiotics, those kind of things. And we'll go through each module. And your IV scheduled floor patients, or med-surg floor patients, will be your blood transfusions, your OB non-stress tests, and IV medications that come to the floor and stay longer than they would in the ED. Remicade, do they stay on the floor?
Remicade does.
And through the other trainings, we determined to put an other on each one to add for something. Someone also mentioned in the emergency department Foley insertions. We didn't have that on there, and apparently that's done more frequently. So at the end of learning to schedule emergency department and med-surg, we'll also go over scheduled laboratory, because there is no pending orders now in Meditech for scheduled labs, so you can't put future labs in a pending order area. So you will be scheduling laboratory appointments, and we'll go over that at the end, okay? So go to your community-wide schedule desktop. And everybody should have this on their right side, which is your patient department appointment book, resource, wait list, and meeting reservations. Wait list,
No, I don't have that. Wait list or meeting reservation.
what do you have?
That can be stops at resource.
Oh, I've never had it do that.
Yeah.
Well,
You don't need the last two.
you don't need the last two, so maybe they've decided to take that off. What you're gonna need is the top four. Wait list, we don't even use, and meeting and reservations, you'll never be scheduling a meeting for anything for a department. This is the screen that's gonna come up. You're highlighted over here in your appointment book. There's two different routes to schedule an appointment. We're gonna show you the first one, which is appointment book, and there's, like I said, two different ways. I find this the easiest. Some other people find the resource the easiest, so you'll just have to practice with it and decide which one is the easiest for you. Just keep in mind, you're just booking an appointment, okay? So you have your appointment book. Go up to your resource group, hit your arrow down, and these are different resource groups you can schedule. The only one right now that you have to worry about is RN scheduled services. You want to click on that, and this is going to pull up your ED and your med-surg. That's what it's going to look like. So you can look at today and see what's scheduled both in your emergency department and the med-surg floor. It goes down, okay? We're gonna go ahead and book an appointment. Let's all go to the emergency department. We're getting kind of full up on that day. Your footer buttons, you can schedule, look at a daily schedule. You can look at a weekly schedule. If you want to know what the whole week of right now for the emergency department is for schedule.
Keep in mind what you're highlighted on is what you're gonna be looking at for the week. So when you went from daily to weekly, she was on emergency room.
Yeah, I'm highlighted up here. So
So if
when
you
I
wanna
go,
look at your med-surg weekly, you gotta be over there.
and just right now while we're doing this, just kind of play with that for a minute. Go to your med-surg, and I'm gonna look at what my week looks like, because I know I'm on the floor. And you're gonna have to see what the weekly, there's a blood infusion coming in, there's a couple OB non-stress tests, Thursday, Friday, Saturday, Sunday. If anybody,
You want to come and answer these questions, because I don't know for sure some, I don't want to give
It's
them all
about how
answers.
you get over to the med
just underneath it, you just have to click on load.
So you can go back to your daily, if you wanna go just look at your weekly ED, you've gotta be highlighted in that
Your
department.
hour increments instead of the 15.
Now, if you're looking ahead and you wanna go to the next day that you're working and see what's going on, you're at work today and you look, you pick up a day and you say, I wanna know what's going on Monday because I've gotta work that day, what's already scheduled. You can go today, pick that day, and then you can kinda see what, for right now, is scheduled for Monday, April 8th. You've got a dressing change, an IV antibiotic,
Everybody's in hours, where ours are 15, so we're trying to change it.
yeah, the time frames, you'll look at our schedule, like Dee Dee said, it says every 15 minutes. For some reason,
That's what it's supposed to be,
That's
so
what
we're gonna
it's-
have to talk to Kelly.
about getting that changed, it's supposed to be, it's supposed to look like this with every 15 minutes, and then you obviously overbook because you could have 3 people coming in at 8 o'clock. So, is everybody playing around with the footer buttons a little bit? So, why don't we go ahead to, let's pick a day, and everybody go to like the second or last week of April, and let's schedule some things. So, and we're gonna schedule in the ED, so make sure you're highlighted on the emergency department.
Go to day. Go to day.
Go today.
I think that's what, is that what you did? And then you just put down and then drop it on there. And then pick it. Okay, got it?
And I'm looking at 6:15 in the morning. It took me to April 22nd, that's the day I wanna schedule. When you go to schedule an appointment, we've gotta change our terminology a little bit. We wanna book. You wanna book an appointment. Okay, we're in appointment book mode, so we're gonna book.
There you go.
Now, this screen pops up next, a patient appointment. That's what we're scheduling. That's pretty self-explanatory because we're not ever gonna be scheduling a meeting. So, okay,
Wait a minute, mine has appointment type and patient, it didn't have what you.
Skips to that
Oh,
screen.
there, I got it.
yeah,
Okay.
so you did your appointment book. You're way ahead of us, Mary.
Sorry,
I didn't do it, man, it just popped there.
So this is where you're gonna look at your appointment types for the ED, and these are the things that have been, that we built in, is a dressing change, injections, IV antibiotics, your emergency department, IV infusions and port flushes and draws, and like I said, it was brought up in a previous class to add Foley cath insertions and then an other button for something that might be rare.
Okay, I go to, let's go today.
Yeah, pick a day.
And then hit okay, correct? It takes us right back. It's right to there. Yeah.
Now go to book.
Off to the side book.
But you're on the 21st, is that what you clicked on? Yeah, so that's your day.
Book?
Yeah,
And then you have to book
Okay,
it.
okay.
there.
And then she said to go to book, right? I think that's what she said.
Yeah. She needs-
We're having just, I think it's our mouse. Okay, so you didn't get today yet.
So we'll go ahead, pick what, service you wanna perform, and you just highlight on that, and here is where you type in your patient. On page, 11, I've got my pages completely discombobulated, but on page 11, there's multiple ways of finding a patient. The easiest, if you know their last name, comma, and first couple initials, that's the easiest way to pull up a patient. But say you got an order over the phone and they said it really fast, you don't know how to spell it, but you got a birth date, you can look up your patients by birth date. There's a number of ways, so just go ahead and does everybody have themselves in the computer?
I think it was, yeah.
Okay.
What you mean? Oh, you
Yeah.
didn't have their patient, their
Yeah,
name?
their name.
Now, we usually don't.
If
try-
not, just go ahead and pull up a
Test,
test
just leave it
patient.
test and then you can pick one.
We have
'Cause
been
this-
using like Nurse Sarah, Nurse Karen, Nurse Marcy.
If not, just go ahead and pull up a test patient, so then you wanna enter that. You can bypass the sex and birthday after you've pulled up your patient. And I know I'm looking for myself. And you can pick, there should be a number of test patients to pick from.
The only problem is if you pick one that somebody else has, you're gonna get an error
Well,
up there.
Karen.
You can't
There
schedule.
you go. Try nurse.
Yeah, Robin's.
Right, there's Nurse Sarah. Is it going in? Oh, you got test manager. Did you go nurse there? Or nurse assistant?
Okay, I just put them in.
I was gonna say that. Mine's gonna say nurse. Okay, so that is really weird. Did you do the updated thing? Yeah. Handwriting. Great.
Like down.
Oh wait, do we have to take one of these people? Copy HIE. Isn't that what you do? See,
Yes,
you guys,
copy.
they have usually have their own help. I don't know.
Yeah, anytime that you see that, that means there's a discrepancy, you always wanna go with HIS, because there's.
So once you've pulled up your patient, you wanna create a new visit. Go ahead and click on that.
Okay. Did you get
It's
it?
not available.
And what's gonna come up next is, this is your screen. And really, this is where you can edit and make changes. You're not gonna be able to bypass anything on this screen that has asterisks. You do have to fill it out. On everything, we have to put a visit reason. So here is not where we want you to write procreate or Neupogen. We'd like a reason. Diagnosis more related, why you're doing what you're doing. If it's IV fluids, you can put dehydration. If it's an injection and it's for low WBCs, but we do need to put in a visit reason. If the patient tells you any information, this is not gonna generate a face sheet, but if they say, I just changed my phone number, go ahead and go into the edit screen and you'll see those edit buttons. Change pertinent information. I wouldn't be changing any insurance or policy number, because that can be done at the time of admissions. But if they say, you know, I got a new cell phone, that's pretty pertinent to having changed on this data. At the bottom, you have scheduler notes, and down here at the footer, it's notes. Go ahead and click on that.
Just a sec, so
Okay.
people are way lost here.
Okay.
Okay, so you've got your, down in here, you have to have a time in there, so I don't let you go by, so I don't know how you've got. Put a time. Put a time, just put a
Oh, it
time.
wouldn't even take me at first, then all of a sudden it was.
Then you actually got this.
And then you always have to tell the
What you
patient.
You're helping me, yeah, sorry.
That means
I know.
it doesn't mean. And everyone was just chopping the.
So it's a new patient.
Right here.
Right now, she's on the
You
notes.
want to click on
This is where you put schedule. This
There you
is
go.
where it'll follow this point.
Thank you.
And notes that
I know, really so long.
Because it's her. That's where she
Yeah.
You don't have to go on anything that's not after. The only thing you have to do is what it has to be like right here.
Yeah. And how do you do that? No.
And it'll always be.
You got the-
Yes.
Karen,
Okay.
I don't know, we don't know what to
So
do
what do you
with this,
do?
because we didn't hear.
Okay, so you need to visit reason.
I can't even get into schedule right now.
Right.
No, this is
I don't believe it was as bad as you can't come in like.
Do you wanna have both of them?
Now they're at.
And I'm hurrying.
So that's that.
You have to do them separate, but it's an easy way to do it by just cut, copy and paste.
So if they're doing a 3-day in-house course, you can put it in individually.
Yeah, but I'll show you a shortcut because there's an easier way to do that.
Now, this is where you're gonna
Okay, is everybody on scheduler notes?
No, not quite yet. Hers won't let us put a visit reason in, when she does that, it goes to the provider.
On
Kelly
yours?
coming by chance?
I just texted Kelly.
Cause hers just keeps flipping to a whole other screen.
Okay.
So is this gonna be weird that, say we're in the ER and this is some orders, and we put them in, is that what?
Uh-huh.
It's already in there.
All your scheduled IV antibiotics.
And then we have to put them in, or they're, if they're scheduled already, we would not be doing this, right?
You need to put them in the scheduler.
Okay. So like if they, like say somebody comes over with pneumonia and they're gonna try to treat outpatient, and they have orders for just today, still put them in the
Yeah.
schedule.
Mhm.
Is that where they need to be? Cause this is how we're gonna chart them.
No, you're not gonna chart on them through CWS,
Okay.
but it's a tracking tool for reports and,
Just, no, just put the BBC.
No, you're, no space. Put a space, you won't.
Comma.
She did her nurse, can't she go back into the schedule? Go back
no, don't save anything yet, because we're still we're
trying to get everybody caught up.
Yeah.
Yours is in there, so.
By the end of the day, I'll have it off there.
Yeah, because you'll just be able to. Okay, now look ahead and
So you don't have to exit out because you know.
that's what's gonna be
Oh,
hard.
all sorts of things.
Right, so it's all out.
And here you can.
It's just opening right here. Doing it.
Well, even on the floor, I'm so busy right now after doing that.
And then you wanna go down here and see your time, you have to have time, it says extra.
I know. I'll go back.
Did she get to scheduler notes, Dee Dee?
Okay, now we're gonna do this. Okay.
Okay, so
You don't ever have
you're
to-
in this screen. This is a changeable screen where you can add data, edit data. You know that you want to put a scheduler note in. That note is going to follow that patient appointment, okay? It's going to follow them. If they're getting antibiotics for 3 or 4 days, you're going to be able to view that note. This is where you want to write information pertinent to this appointment. If you're starting an IV, you might want to say, difficult IV start, anything that would be pertinent for the next nurse that has to take care of the patient, because when she pulls that appointment up, she'll be able to look at nurse's notes. Okay? Go ahead and hit OK. You've done that. Down here, you have to fill in all the asterisks. For right now, patient appointments in the ED and on the scheduled floor are clinic appointments. Okay, even if they're on the floor, that's how they're gonna be coded. The other statuses are inpatient, inpatient observation, provider office visit, recurring, which is only used for therapies, PT, pulmonary rehab, cardiac rehab, speech, those kind of therapies where they're coming in Monday, Wednesday, Friday, etc. We're not ever going to use referral, and SDC is surgery daycare.
We
So-
get rid of them, or can they take them off of there?
They stay up.
Yeah.
So that's why just yours is clinic and clinic only. You don't really need to think about those others. Okay, nothing else is asterisked on here. Once we save this, okay, go ahead and save it. What's gonna come up next is let you view the appointment you just made. And this is where you wanna double check your patient, your date, your time.
The line comes up, insurance absolutely.
Sue, I think this one will work.
Cancel.
It's taking my stuff.
Cancel your screen for copying an admission form because you are not checking this patient in, you're booking an appointment, so bypass that. You're gonna see Jane Test on Monday, April 22nd at 6:15 to the emergency department for RN scheduled services and an injection.
If mine says cannot be booked, does that just mean that there's something already scheduled for that time?
Mine can't either.
So anything that has something.
Sorry.
That's all right.
Yeah, I think what's happening is there's too many people all probably doing the same time.
Okay, you just want to stay here.
So you either have to wait until somebody gets done and then it'll come as overbooked or pick a different time.
I took myself out.
So close.
Yeah.
It is gonna let you overbook, but what might be happening today if we all pick the same date's time, which
Just try a different time.
it's,
So what if you have two patients that, I mean, a lot of times you do have two patients come to the ER at the same time for a scheduled, and it will,
it just gives you an alert that this is gonna be an overbooked appointment, do you wanna proceed anyway? And you'll proceed and then we'll show you what that'll look like because it'll come up red. And I'll show you where you can click on that red and look at what all you have scheduled for that day. The color codings are on page 27, what all the different colors on the screens will tell you. So I'm gonna go ahead and close and keep that appointment. Okay.
Oh, I just got no, I don't know, face sheet, is it okay there?
No.
No, we don't want to.
Anytime you see something come up about a face sheet or admission form, just cancel through that. Because this, again, this isn't the checking in process, it's just the scheduling process.
Yeah.
Well, just so you can look at it.
Well, it
Yeah.
showed.
Yeah.
Well, yeah, it showed that it had a.
Yeah.
I personally didn't see what should have gone from there.
Well, then she said just close it and put it back. So I
Jane,
Yeah.
Is there
possibly a
way maybe
Yeah, cancel this.
you know, sometimes we have
There.
patients come in,
So now
so
they
they
show
show
Uh-huh.
Is there a way to mass book them so I don't have to go in every single day
Yeah,
and
we,
edit everything?
yeah, we can't do reoccurring, but we can cut and paste. So you make that initial appointment, and then we can cut and paste to how many days in a row they're gonna come. Or copy and paste. The unfortunate thing, yeah, the unfortunate thing is each time you're gonna have to put the visit reason in.
Okay.
It doesn't.
So it's still gonna.
Yeah, it's not, you're not gonna have to go through this process each time, but you do have to copy and paste, and each time it'll ask you a visit reason, and I think it comes up to ask you what, you know, if it's a
I
clinic
know, it takes a while.
appointment, which it is, and that terminology we're not used to either, because you think of clinic, you're thinking of outpatient,
I used to.
all of those coding are all different.
They don't know much about it, they usually think that they use it, I can kind of picture through, but I can't tell you for sure. Exact. I know my stuff.
So, did we get everybody scheduled an appointment in the ED?
It's getting hard because there's
So many appointments, so should we go to May, maybe?
Yeah.
Do you wanna do it again, is that what you mean?
Let's go ahead, we'll schedule an appointment in the med surge. This is the same way that you schedule an appointment in the emergency department. Let's go to the footer and go today. If everybody wants to pick a day, but why don't, we've got a lot of things booked at the end of April. I'm gonna go ahead and overbook somebody just so you guys can see where, okay, but if everybody else wants to go ahead and schedule an appointment in the first or second week of May, okay? So you're gonna wanna pick your date, go up here, get something in May, I'm not gonna do that right now. And this is where you go, once you've picked your day, you go to book. I'm booking a day that's overbooked for this time. When that happens and you know you're gonna be overbooked, just go ahead and say yes. You should be getting to this screen next after you've picked your day. It's a patient appointment always. Appointment type, you're out on the med-surg floor. Your 3 choices are blood product infusion, med-surg floor, IV infusion, and an OB non-stress test. And then Phyllis wanted us to add hearing screening test. Do you guys generally book those, or do patients just walk in?
And we need to make a paper form, like.
Okay, so I wondered about that, if that's something we really,
Did you let me
After the
do
doctor
one?
appointment, it's
And
free
then
service
you
that
do one
is
with
going
all
on.
yeah.
No,
That's what we were wondering, if the hearing screen needed to go in there.
Because I was trying to bring up my name for
So
this.
we will put another category under there as other, in case there's something else in the future that comes up that we might need to do. So I'm booking
And that's what I did, but actually Sue.
a blood
said
product
something.
infusion.
She has a question, which I don't.
You can just click on this to go to
I
it.
think it's
You
about,
click
you
on
put the
whatever
patient's
time
name.
you want. You can scroll down the time. And then you can
Go ahead and put your patient name in and hit OK. You can always bypass the sex and birth date. It refines your search a little bit, but generally, if you know who you're booking for, it's easy to go in by name and first initials. I know, and they'll pop up a number of patients with similar, or the same last name and similar first names. I'm gonna go ahead and book myself. I'm creating a new visit.
I'm a tripper too.
I know.
And that's where you come to your edit screen next. Always think about your visit reason and try to be
Okay.
precise. I'm just gonna put anemia for this blood product infusion. Patient type, even though they're going out to the floor, they're not a hold and observe, they're not obviously an inpatient. Just keep in mind, clinic is what you're gonna pick for your ED and your med-surg floor. All of my other asterisks are filled, so I'm gonna go ahead and save this appointment.
Please don't put the medicine names there, the medicine.
There are times when a screen will come up about, do you want this information? It doesn't happen every time, and we really haven't worked out the kinks why it happens sometimes. Do you want a copy to go to health information? Just always put yes.
Yes.
Yeah. I'm not running a face sheet, I'm scheduling this, and then it tells me what my appointment is. The date, the time, it's med-surg floor, it's under RN scheduled services, and it's a blood product infusion. Now you're gonna see on that day, you've got an overbooking, okay? So when you
Side's red.
click on red when it's multiple for overbooking, you can just click on that, and up in the right-hand corner, it's gonna tell you who you have in those multiple appointments. Okay, so we've got Carly coming in from 7 to 9, and then we've got Jane coming in at 7:30. IV infusion for her, she's getting blood. You can review it real quick, what those multiples are.
And the majority
Does
of
yours have
Huh?
Does yours have name and route up there?
Yeah, yeah.
The majority of these
Jansen and Janelle do right now, because they have to okay our visits to the ER and
You're allowed to
have
Well, I mean, IV antibiotics, they don't give approval for, do they?
I mean,
well,
They receive the order,
yeah.
but they're not getting it pre-auth. I mean, like IV antibiotics or a dressing change.
A dressing change they probably talked to us about, but
Yeah.
maybe an IV antibiotic if they
Yeah.
come from the clinic.
Yeah, I mean, and I don't know how your process works. I mean, as far as if they get that approval and then they come back to the ER and give you the order,
We still
and
have to put it in.
you'll still have to put it in, or that communication will have to take place. If Janelle or Jim is getting an approval for, Jim's not gonna be entering anything in schedule or,
Okay.
but if Janelle gets an approval for appropriate or Neupogen, and if she goes ahead and schedules it, when she gives ER the order, she'll just have to tell you that.
And you don't have to like schedule people that show up at your door.
Oh,
You don't have
Oh, I thought that
Oh.
we decided they did.
That's
You
what
mean
about
when
that.
they just come in?
From the
Here I
clinic.
am, I
Right.
want an antibiotic.
We don't have
Or
to obviously
whatever,
put
you
them
know,
in
'cause I wouldn't
the,
think these would be things you would be scheduling like now. Now they don't schedule things, they don't put those in the book.
Do you put it, do you, okay? Like me,
Not
for
for
me?
me.
We like the for tracking.
well, we
Yeah,
don't, we
thinking-
don't
But
put
you'll
it
have it-
in the
you'll have it in the
scheduler, we
admission.
put
Yeah,
it
then
in
you
the
can
book.
track that way.
Oh,
I-
because I thought you did.
No, we don't put it in the scheduler, like if you came in,
Like I
you
do
know,
for
I
flashes
wouldn't,
or.
I
I mean, I
wouldn't put
wouldn't think you'd
you,
take
I
time
wouldn't
when somebody just
schedule
pops
you
in.
for.
Dr. Brandon sent one over yesterday for
But I would
antibiotics, so
put you
I
in the
probably
book
wouldn't
as
put them in at that
patient.
time, but then she also
Yeah.
scheduled them for
And then
today
I
in
would
lab,
keep
so
track.
then I'd put it in for today in lab, right?
Right.
But not that one initial time
Well,
that
I
I did
wouldn't
yesterday.
say you do it
They're
right
already
when you show
admitted.
But I
up.
don't think,
Cause they're already admitted, so
Yeah.
what do
It's
you,
kinda strange.
Yeah, why would we put them?
Yeah.
why,
I think the
how are you
question
gonna do
is getting
that?
confused.
Yeah.
We wouldn't
I
put
thought it was for
you in the
tracking,
scheduler
for
if you
report
just came over
purposes.
from the clinic, like if the doctor said.
But you'll be able to
Put it,
track,
you
you
know,
can
admin
do that by
schedule.
the admission.
I
So
like-
she
I
said,
never
I'll
scheduled
track
that.
them off
And
of.
schedule.
But I'm
So then we
finding
hardly
out.
ever
Okay,
Like I
Will
know.
be
Okay.
deleted.
I didn't know she
Because
was
if they
doing
come in
that.
for an antibiotic, we're gonna treat them as an
I mean,
antibiotic.
that's what my assumption
Unless they're
is,
gonna be
is that
back
you're
the
gonna
next
do
day
it
for
the
another
same
one,
way,
yeah.
because.
Probably more the Schedule
Yeah.
4
It should be
patients,
here.
because those are planned ahead of time. Those generally, I mean, occasional blood product transfusion, they just call and say they're coming.
Mary, is it?
Cause this isn't, I mean,
Right.
this is just a scheduler, this is
Well,
not
I don't know
gonna
why
be
it's up
what
twice.
you chart on,
Right.
or what we
Yeah.
chart on, or what we
Yeah, there's
code
no
off of.
charting off of this, or coding.
So, I mean, you're gonna be getting your reports off of your main stuff.
Oh, they take like
So,
bills,
to
it depends on the
clarify,
time, Mary, you got two blood.
if somebody came
products,
over
like 4
from the
hours or
clinic
something.
as a scheduled patient, that day, new orders, we're not gonna put them into the schedule.
Yeah.
Is
Okay.
it just, you
You're
guys
just
like
gonna take care of them, and, but if they're coming back the next day,
Oh,
Right.
you're
Then
getting
we would
another
schedule.
antibiotic,
We
put
had
it
to
in
do
for
that
the
when we
next
set it
day,
up.
so.
like an idea
And that's
of
kind of the
confusion,
process you do
just
now
put
with the Black's
you
book.
get some are
Yep.
25, some are 60, some are 120.
So like the blood, if you
Um,
get 2 units, that
Like
really about
here,
8
I
hours.
got my meeting.
Right, and you can change that time anytime
Sometimes
you
they'll
want
say,
to, or
tell
you
us
can
how
just
you're
book it
feeling
twice.
tomorrow, if you think you still need, if you're not feeling good, then come back.
Copy
Can you
it.
schedule that then,
Yeah.
or let it go and wait till they show next day?
Did you
Or-
blood
I-
twice,
I
Mary?
would
Did you
personally
blood
just
twice?
do
I wouldn't schedule it
Did
either,
you
would
blood
you?
twice or did it do
Because
it?
what if they show good days on time,
Yeah.
they get it.
You know,
Otherwise,
if
when
that's
you
the
schedule
case,
it,
I
you
probably
know
won't
this is
schedule
gonna
it,
be,
and if they
there's a
did
time
come,
down
you
there.
come in,
then
you just
treat
treat them, but
Actually schedule
if you
it.
do put it in, then you've gotta
You
go
can change
through
the
and
time. If
cancel
you know
it,
it's in
because
the
it'll be in
So
the
we better not
schedule.
do that.
Yeah.
Can't you just have them put it in and then put notes in, patient name, cash shows, at least that the person's gonna know the schedule that's coming
Well,
that day.
Yeah, I
They know
mean,
what's gonna be scheduled
yeah.
in the ER. I mean,
they can
those
you
notes.
know, kind of plan better if they think maybe Joe Blow is coming in, and the scheduler notes, if they're utilized appropriately, really communicate to the next nurse, hopefully enough information that, you know, in your notes, I guess you could put, you know, came in today, had this, is supposed to call back, let us know if they're coming, and then that person would just have to cancel the appointment.
This might be a dumb question, will the aides or the ER techs have access to those notes as well, so we can relay that to the nurses?
Yes.
Okay.
Yeah. Anybody that has access to community-wide scheduler and looking at appointments will look at schedule notes. And where is the section?
Supposed to be on silent.
But then I have some other thing.
So where are you?
I have so many appointments in here, it's not.
Not there, you don't. You right there.
What's that?
Dr. Stark is one. It goes dark.
How did you do this?
It just,
You know what? I'm thinking about it.
Somebody must have picked the wrong Jane. I wonder if that's not even
Again, that's, this is how it's gonna look when you pull up that appointment book. Always remember, if you're over in the ED, when you're gonna book an appointment, that's what you're booking for. If you're booking someone med-surg floor, make sure you're highlighted in that area. We're gonna go to resource mode. That's below your appointment book. This, again, is another way to schedule appointments, and it's also a very good way to look at, view your month at a glance. Also, we are in med-surg floor. Half moons show the date that these services are available, and obviously the floor and ED are available every day. They start to fill up. You know, at a quick glance, you can see there's nothing these days, but on these half moon days, something's already scheduled. You can hit April 2nd. Over to the right, you're able to look at what that schedule is and who's scheduled. Again, the red is overbooked. Whatever you're highlighted on is the patient information and appointment information that is scheduled for that patient. This is also a real easy way to change appointment dates. If you have Katie, nurse, that said she was coming in on Tuesday, April 2nd, and she calls and says she can't come in until Tuesday, April 9th, it's just a matter of clicking and dragging, and that will change your whole appointment date. You move her over here. Oops, I ran out of room on my pad here. And I put her on April 9th. Well, she was a no-show.
Because it's April 2nd, yeah.
Okay, I'm batting 0.
That's right, you need to-
Okay. Let's go to today. Something scheduled for today. There. Okay, these are your appointments scheduled for today. You're obviously, I was on a past date. I'm not gonna be able to change that appointment because it's already come and gone, but I called in and said I can't come in Friday, April 5th. I wanna come in April 9th. You just click on that patient and you drag them to the date that they said they're able to come. Let go. It's gonna say your new date, which is 5/18/13 or 5/8/13, and the new time. They're gonna be here at 10 o'clock. Okay? Always, on any time you change any appointment, whether that's in the resource mode or appointment book mode, you've got to give a reason. So this was booked in error. It'll track down below who's changed appointments and why. Duration does not equal the summation of all resources, and that's just our times are not set up correctly yet.
You have to go to,
That scheduler note is gonna follow that appointment,
do the current
and this
day.
is telling my appointment is filed. We don't need a printed admission form, it's a future booked appointment.
Then everyone I try to see somebody else's duties and so that's why.
Okay?
Did you figure
So like when the MRI is gonna be here, or CAT scan, or you know, whatever, is there someone we can look to see?
Yes, I was gonna show you that. No, that's okay. So, yeah, I can go look to my April 8th and see that my appointment did get changed, okay? You won't be scheduling anything else for departments other than ED and scheduled service, and again, we'll go over lab here at the end. But if you're discharging a patient and the doctor says, you know, I need them to get scheduled with Dr. Hibbard at his next available appointment, it may be easier for you to find Dr. Hibbard And that will tell you, based on the moons, the days that he's here.
How did you get to that?
That is up by your resource
Okay.
mode. So up on top, these are all the things that could be scheduled. You can look at the CT schedule. These are the dates, they're available every day. You know, obviously, you know they're here. I'm trying to think of something else. They need to schedule an ortho appointment on discharge. And the doctor says, well, when are they gonna be here? They're gonna be here April 12th and April 3rd, and by the looks of those appointments, he's wide open. You know, and again, you'd go through your same process and call outpatient, Lori or myself or Christina, to book it. But this gives you an idea to tell the patient, to tell the doctor when they're available next.
So then you guys will do the booking?
Yeah, yeah, the booking of appointments for you guys will only be your ED and scheduled floor.
Thank you guys.
Okay? There is one other area that you're gonna have to book, and these are gonna be laboratory. Like I said, right now, lab does not have, they're in Meditech, I should say, pending order entry. So when you were discharging a patient and they discharge them and say, well, we need him to come back Monday for a CBC, you know, Karen, we'd always just go into pending order entry, put that CBC in for Monday, and that order would be there till the patient showed up. Well, there is no pending order entry right now, so what we're doing for right now is putting in lab appointments so that the patient is scheduled for a lab appointment. They can come in Monday, lab will pull up their appointment book, and they will put the orders in from that appointment. So we're not putting any orders in, okay? Yeah, this is just a booking of an appointment. This process might change. I mean, this has been kind of a controversy just because it's so much different than the process that we use now.
How will lab know what they're supposed to?
Well, I'll show you. We'll put in a lab appointment and where you put in what they're gonna have and why. Keep in mind, if you're discharging a patient and it's a discharge appointment with an office visit, you don't have to schedule the lab. Mary Jo and Rhonda will schedule that for you. This is only if you're discharging a patient and they need lab in the future. No appointment associated with it. Does that make sense? So I'm being dismissed from the hospital and I've got to come in Monday for a CBC. The nurse is going to have to schedule that CBC. If I'm coming in Monday to see Roger and get a CBC, we call Mary Jo, Rhonda, schedule that appointment, tell them what lab they need, and they take care of it.
They schedule the office appointment.
They schedule the office appointment and the lab. The only time you're going to be making lab appointments is when it's lab only. And scheduling lab appointments is exactly like scheduling the ED, exactly like scheduling med-surg. So we need to change our resource up here. And you want to change your resource to laboratory. Okay. And I'm going to book. So everybody can book a lab appointment.
Okay. She went to RN resource and then from there,
But we're doing lab.
yeah, they're gonna order that.
There it is.
I'm not sure why that's So then, what is she going to check? She said,
So I don't know, like clip them on it
It's okay, Mary. It's all
and
right.
not work, so.
Look at it.
You're gonna book an appointment.
See, right now, you're not, you can't book because you're not.
Probably gonna be many times you're overbooking for lab. And when you discharge a patient, if you can, at least from them, if they're just coming in for lab, get a tentative time, or if they know they're not coming in till the afternoon, schedule it for the afternoon. Lab's gonna draw the patient no matter what time they show up, but it gives them kind of a better idea. My patient appointment, when you go under lab, you only have one option, and it's simply laboratory.
Oh, no, because it won't, if you click just watch your gracious information, so just type nurse or test or whatever you're searching.
You're creating a new visit, pick your patient. Visit reason is really important to fill out if they're having multiple lab and the reasons that they're coming. Because if not, lab has to put that in under order management when they go to put that lab in. So if you're doing a CBC because of anemia and a BNP because of CHF and a PT-INR because of Coumadin therapy, you want to put all of those things in. If you're doing multiple labs for multiple reasons, put all of the reasons in. And this is really imperative that you do this. So CHF, okay,
Because somebody would put the different.
Okay, okay, you put in the visit reason, then you wanna go into scheduler notes. So you go to your notes at your footer button, and this is where you're gonna put, I need a CBC, BNP, PT, INR, and the most information you can put on here, the better. You don't wanna write a novel, but, you know, they are gonna be looking at this. And this has to, you want to be cautious of spelling, putting in the correct laboratory, because this is where they're getting their order to go place it in order entry. So CBC, BNP, PT, ENR per Roger Wells, dismissed acute on 4/1, because that again will tell you where that order really generated from. Okay. This is where lab is gonna pull up their appointment when Jane Test shows up, and it's gonna say, this is what you need to draw and why.
So-
Okay?
What about when they are just coming in for a repeat chest x-ray?
With radiology, just call radiology and let them know what the order is.
Okay.
We're not putting in any radiology
Okay.
exams.
Okay.
So if it's a repeat chest x-ray, a scheduled CT scan, radiology wants to schedule all of their own exams.
Okay.
Good question. So, just laboratory. And then again, you can't move on till you fill all the asterisks. Patient type, this remains a clinic. You're gonna wanna save this. I will say, if up here, if you see that alerts exist, we had put in alert earlier on me. It's showing up now. Alerts is what's gonna follow the patient throughout. And that's at the bottom of the footer notes. I have that in your packet, but I'm not sure what page. And that alert was typed in by a different nurse throughout a different appointment scheduling, and that alert is staying with that patient. Do not take blood pressures in the right arm.
Suppose that alert is no longer pertinent, how can you get rid of that?
I think in the view mode,
You know,
are
say
not
it's
the
like
view mode, but
metformin, don't take metformin times 2 days, and now it's been a week later. and-
well, that isn't something you're gonna wanna put in there.
Okay.
Like something like that before a CT scan, yeah.
Okay.
This is something more, like I said, it stays with the patient, you know,
Like they have a mastectomy and they
something
can't-
like that, like the, you know, don't take the metformin for 2 days would be in your scheduler notes.
Okay.
Because that follows that a patient with that appointment. These alerts are something that,
Anaphylactic reaction to penicillin.
yeah,
something
So it'll
that's
gonna always be
that's
there.
gonna
So if you
stay,
get them, it'll
yeah.
still be there.
yeah.
That would be, okay.
So I'm gonna save that appointment.
Put that in my notes, please.
You're gonna have a screen pop up, probably a lot in laboratory for overbooking, and that's the way that it's gonna be. You're not printing an admission form. And then you can tell your patient you scheduled on Friday, April 5th at 7 with the lab. Again, you don't have to get exact times if you're discharging a patient, but if they say, I don't get off work till 4, you know, don't put them in for 7 a.m. But
You can put that down in the notes, maybe it probably won't be in.
yeah, yeah, and then go to your 4 o'clock time slot and schedule it then. Like I said, if someone's scheduled for 3 o'clock and they come in at 8, lab is still gonna draw them, obviously, but. And we're working out some kinks with that part with laboratory because of no pending lab.
No.
Do you guys wanna go through and book another patient?
Somebody said no to you. I was like, who said that?
Alrighty. So, let's go back to appointment book. I don't know about you guys, but I found this is the easiest way to schedule an appointment. Resource is a nice way to look at your month or look at the day, but
Start back from the beginning again, would you just go, do you mind?
no, in appointment book.
No, go back to where you just got on the screen and you go to CWS,
Okay.
if you don't mind.
So, when you pull up your nursing board, you're gonna go to community
How'd you
wide.
get back that far?
That's just the very first screen that comes up when you've logged in.
You know, dashboards.
You guys don't have to follow, she's just wanting her to go through.
Yeah. So, community-wide desktop, I'm scheduling. And after you get into your CWS desktop, the first thing that comes up is your resource. Okay? Always use your drop-down arrows when they're there. Nurses are only going to use RN scheduled services and laboratory, okay? If you're scheduling lab for a patient on dismissal, you're going to want to schedule in the laboratory. If you just received orders for a patient that's coming in for blood tomorrow, you're going to go to your RN scheduled services, and you're going to see your RN ED on the left and your RN med surg on the right. RN ED is up here because you're highlighted on that department. If I hop over here, and I'm in the med surg department. So I just received an order to schedule a patient for a blood transfusion the next day, not Friday, April 5th. Your footer buttons can give you the weekly view, a previous day, I want to go to the next day, or you can pick a day. Okay, you can go to the calendar and pick a day. I want to go to the next day. I'm on Saturday, April 6th on the RN med surg. This patient's coming in at 7 a.m. And right now I just want to book their appointment. Okay? You're in appointment book mode. Right now I'm going to book it. And I'm going to book a patient appointment. Meeting reservation will never be anything that you book. So, okay. Appointment type are your options of what you can book for the RN med surg floor. And I'm booking a blood product infusion. And I'm going to be booking it on This patient, again, last name, comma, initial, no spaces. And there's another way of looking at patients in the packet. You can bypass the cancel for the sex, birth date. Okay, these are gonna give me my options from those names. And I'm booking Jane test. I'm creating a new visit for this patient. It is reminding me that the med surg for RN scheduled is overbooked for 4/6 at 07. Book it anyway. Obviously, we're gonna book it anyway. We need to know why she's coming in for a blood product infusion, anemia, what other diagnosis that you might have for that patient. This is where you want to edit your screen at any time. Again, especially phone numbers, if they tell you they have a change schedule or change that, go to your edit button and you can just go in and change the phone number. I wouldn't be worrying again about insurances, that'll be done on the admission side. I want to put a note in here because we've taken care of her before and we know she's a difficult IV start, make sure and
Feed her. She's
Okay.
diabetic.
Okay, just anything that you might wanna put, because you're not gonna be here tomorrow, you know a lot about this gal, but you wanna communicate that to the nurse that's gonna take care of her. You wanna keep your notes professional, they don't follow the chart, but you may not wanna put, she's a real crab, or anything that's pertinent for that patient, that will help the nurse take care of her better. Patient type, obviously she's out on the floor, but she remains a clinic patient. And you're gonna save that information.
That location, we had a room number picked out, we put that there, what's that
I put in a patient schedule for IV.
Let me go back.
Saturday.
No, the location is, all of these appointments were derived from specialty clinic.
for? Oh, okay.
So, when they were built out of specialty clinic. So it's not an actual physical location. So I'm gonna cancel this, I'm scheduling it for tomorrow, I don't need a face sheet. And you excuse me, you have an opportunity to review your appointment and double check your date and time and patient. I'm gonna go ahead and close that. I can look at my booked appointments for RN Med Surg on Saturday, April 6th, and then I'm thinking, boy, what all is going on tomorrow? So I click on my multiple appointments and I can see I have 2 bloods coming in.
Oh.
They're listed up there.
Saturday, is that right? Saturday, Sunday, it's not open.
For scheduled lab.
She's trying to schedule. So try the 11 o'clock.
Let me do 11 o'clock.
Yeah.
What time of day did you do?
Well, I put it at noon.
I think it's,
I put in a schedule of antibiotic at noon, and I was gonna put lab at work done with it at that time too.
Okay. yeah, because it's at noon. Because they're available, but not for scheduled stuff. After that, they're on call.
Okay,
So that would not be a scheduled appointment.
okay.
Whoa, we got lots of stuff.
I'm not working that day, you do that.
You have to get up there. Get some.
Yep, that's the time.
We're going to the weekly schedule for the RN Med Surg. And we just found out some patient appointments need to be moved. When you're in appointment book mode, the best way to move appointments, actually the only way, isn't it?
Other
Is,
than just going and editing it, you can do that.
yeah, is the easiest way then is the copy and paste. I'm gonna highlight on my Whoops, it
Now
was
you're
just
moving
updated.
this one, right?
Yeah,
So we're gonna cut it. You're gonna cut it out of there. When you're moving a patient, you're gonna cut them out.
so you might wanna make those notes, cause we'll go into, on resource mode, how you can move them. So when you're in the appointment book, you wanna move it, you have to cut it. You highlight on that appointment, you go to cut, you change it to another date, you go ahead and go to that appointment and you paste it. Again, it'll come up,
With your new
your
date.
new date, your new time. This will track who's making changes
You always have to give your schedule.
and
reason.
schedule reason. So we had to move that appointment because the
Oh, 'cause you
patient
did
was
it.
sick that day and she changed her appointment. So you wanna hit okay. So,
So what if you wanna get rid of them completely, say they died or change doctors or, can you just get them out completely?
yes.
Yes.
Well, I think in that one, that's
Maybe.
So that appointment that was over here on Patsy Test has been moved to Sunday, April 7th.
Can you
Cut right
go
there,
through that one more
but
time?
it's not.
Uh-huh.
So it looks like, now you can.
Are you on an appointment? It's best to be in your weekly mode at the bottom because then you're, if you're scheduling it within, rescheduling it within that week. If you're moving your appointment, highlight on that appointment. It's gotta be in the, can't be on the actual day. Let's move. Highlight on that appointment. You hit your cut button. You take your mouse and move it to where you want to change it to. Highlight on that day and hit paste. It gives you your new date and time. You always have to put in a schedule reason. And we booked it in error.
What is attendance status?
Attended means that they've been checked in by a business office.
Okay.
Like this one, you have,
She didn't have us hit edit.
Well, get one.
Oh, you can't do this pass.
Go like next
Oh,
day.
okay.
Actually,
Say the ones that
we're gonna
We're
copy.
gonna move them again.
So that's not the same as this.
When she files, it won't take visit reason.
Okay, now when you have somebody that you know is coming in for 7 days of IV antibiotics or 5 days of Neupogen, the easiest way to do this is to highlight on it.
Because you've already scheduled at least one
Yeah,
day.
You
You have to
scheduled
schedule
one day.
Copy it,
Copy it.
put it in for the 10th, whatever time, if he wants to come again at 8, paste it. The only thing is with these, unfortunately, we had to make the visit reason a necessity because of lab and for other things. And so you're gonna have to every time put in the visit reason, so.
So we know that SAM test, IV infusion is gonna be coming in the 9th and the 10th.
So you have to put your visit reason in, and then save it. And then you can copy it again to the next day, and you can just keep copying
This is
it.
kind of that question you had, Amber.
Yeah,
you know, to get which
I
one.
didn't say no what I do.
So if you know somebody's coming in 5 days in a row, you don't.
keeps telling me I can't overbook, so I can't put two patients in the same.
So here is your first appointment that you made for SAM test. You know he's coming in the 10th. So now you wanna do it again because he's also coming in the 11th.
Yeah.
I have him highlighted. I'm gonna copy
Yeah.
to this date, and now I'm gonna paste. And that same thing is gonna come up,
They're not gonna get this one.
and again, fill in your visit reason. I'm just writing anything in. I'm gonna save it. So copy and paste is how you
This one. Yeah.
schedule back-to-back-to-back appointments.
And there you can see he's down for 3 days now.
And it's the same appointment, you know, the same.
You don't have to go in and schedule them every single time to do that.
As far as we want to pick ones that come in for 6 weeks.
I know. You know, I know you might want to only do a week at a time, just because you never know what would happen too. Then you have to go and cancel.
Oh, yeah, can you show us how to use it? Like, he's got a doctor's appointment one of those days.
Check it out and check it out. It's the same thing, you have
Okay,
patients.
so we've got to register. Okay, when a patient checks in, this is how you're gonna change your times to, when the business office checks them in, the appointment will look attended, and then they'll change them to arrived, and you just have to check them out, okay? So right now, we're just gonna go through, a registration process, so if you guys just wanna watch this, also you're gonna learn registration in your training for today in ER.
What's the concern? No, let me.
We'll help.
It just providers, you're on insurance.
You know how to do it.
Yes, we do, we have a number on speed.
We just wanna show you what it's gonna look like.
Now you should be able to. Let's do this.
As they're being registered, their account number, their medical record number is gonna come up for that patient. After that patient's been checked in, you go to patient mode, you highlight on that patient that you see. You can see that the patient's been booked.
It should say attended, I don't understand.
This happened yesterday, we're not quite sure if it's something that has to be worked out, but status, at that point, once the business office has checked them in, or if the ER tech or nurse has checked them in, their status should be attended. So why that's not changing, I'm not sure, but we'll find out that key. We're highlighted on the, we're highlighted on that appointment. These are your options, when you're ready to check that patient out. You can put what time they're arrived, and actually, the person checking them in will probably put the time arrived. We're just gonna go with now, or let's do 8 o'clock. What time they were seen is not a mandatory field, but if you wanna put what time you saw them, but you do have to fill out your departed time
So what time they were seen is by us?
by
not
us,
provider.
yeah.
Okay.
It's not a tracking for provider and time arrived and that kind of thing. And then you're gonna have to go back in and check out that they checked out now and they're departed. This should change to departed, yeah. So you'll see that they departed at 9:11. I don't know why that's not changing, do you, Kelly?
What's up?
Why that booked when we register a patient isn't changing to arrived or attended?
It might not just refreshed.
Okay. So we probably didn't give it enough time to take that information in.
So say you have like, a patient that's coming in to get lab, and they just completely cancel the order. How do you get them out of there?
It's on the book.
You'll go into the patient mode and click on
Okay.
booked
Change status.
and change status. And your appointments are gonna be, they were a no-show, canceled, or pending.
We just have pending and canceled. but that
You don't
matters.
have no-show?
No.
Okay. And give a canceled reason if you know one. The patient was sick, okay? We're not creating pending appointments. And then it's asking you that there's no other appointments related to that patient for today, cancel that one, and you say yes. Again, this might need a minute to, there it goes, and it's canceled. That is under your patient mode, okay?
Okay.
I think you can do that under,
You can do it under
under the
edit
other modes
too.
too.
Okay.
Appointment book mode, I think you can do it under maybe.
Yeah.
I knew you could do it.
And really the best way to get acclimated to, like any of, all of this other new stuff we're learning, is just to practice it.
Just play with it, see if you can break it.
So then you call Kelly, what was your extension again?
4:00 in the morning, I'm broke, Kelly, I'm broke.
But anybody on the CWS core team would be happy to help, and even when, you know, we go live, that's Dee Dee and myself and Mary Jo. Kelly's been our IT specialist, and Lori, Kathy Larson, with physical therapy, and is a wealth of information when it comes to scheduling. And Jalen, and X-ray, and anytime any one of those people are here, that you just have to call and ask.
What about physical therapy? Do we ever?
We won't be scheduling anything for physical therapy.
Okay.
So if you're in practicing and you get stuck on something, don't be afraid to call. We'll be more than happy to help.
Call those people at that extension, and, because really the only way you're gonna get used to scheduling those appointments is just to practice. That's all for scheduling. Thank you. Thank you, guys.
So there's an order, four pushing on the floor.
Maybe you know how to do it, Janelle, I don't know.
You said if there's something
It's
kind
been a
of
while.
break, you put them in there.
You just said, just the button.